Awesome. Hi, everyone. Welcome to our Community Leader Keynotes. My name is Catherine Nassal, and I am CPEN's Policy Manager, and I'm your facilitator for this session. I hope that you all have very full bellies and that you've been able to dance your lunch away. Thank you to DJ Rosa for providing the amazing mix, the amazing music. I hope you all had like a mini dance party in the middle of today's session. A friendly reminder to complete our 2 polls. This will also help us know who we have in the audience today. And to kick us off, I'm so excited to introduce Assemblymember Rebecca Bauer Kahan. And the Assemblymember Rebecca Bauer Kahan was elected in 2018 to serve the 16th Assembly District, which includes the communities of Dublin, Lafayette, Livermore, Orinda, Pleasanton, San Ramon, Walnut Creek, Danville, Alamo, and Moraga. So a lot of East Bay love. Please shout out in the chat if you are in the district. And so I'm going to pass it off to the Assembly member. Thank you so much for joining us.
Thank you so much, Kat, for introducing me. And hi, everyone. It is an absolute honor to be here today. And I want to thank CPEN for inviting me and for this important topic that I'm proud to be a champion of in the legislature. You know, I know that CPEN conducted listening sessions in the 2 counties that I have the privilege of representing. And I just want to highlight the importance of the work of listening, especially to our communities of color. I'm going to speak a little bit about the legislation that I championed this year, AB 988, but it was born out of listening. It's named the Miles Hall Lifeline Act, and this piece of work was born out of meeting with Miles's mom and hearing her story and how he suffered, and knowing that we needed to do more for communities that were suffering from mental illness. So I just want to recognize the important and critical work that listening is, and thank you for doing it. And hopefully we all do it more and then respond and do the work of getting to more racial equity in the healthcare space, and specifically the mental health care space. We are far from equity in any space, but including the mental health care space. And AB 988, which was the legislation that my office championed and was really a piece of legislation that was very close to my heart. I'm not supposed to say it was my favorite, because they're all my babies, my pieces of legislation. But, it was really, really important to me, because fundamentally what we were trying to do through AB 988, and what we continue to do, I shouldn't say the work is far from over, is to make sure that those that are suffering in mental health crisis get a healthcare response, right? Currently, if you're in a mental health crisis, you call 911 and you get a public safety response. You get law enforcement showing up to support you, and law enforcement is not trained or prepared to do that. You need someone who is a mental health expert who can support you in that moment of crisis and get you the care you need. And so that is the work, is to make sure that people are not calling 911 and getting a law enforcement response when they need mental health support, that they're calling this new number 988 and getting an actual healthcare response. And this was actually a gift from the federal government. Surprising, I would say that. It was signed by President Trump. I didn't know that I'd ever say he gave us a gift, but he did in this legislation that he signed, that enabled the states, including California, to create a system around this new phone number. So 988 will become live, and if you call it in July, when it goes live, July of 2022, you will get a suicide prevention lifeline through that simple 3-digit number. But the states are enabled to do so much more than just provide you with suicide prevention lifeline. And so what we are trying to do through AB 988 and the work we are doing in the Capitol is create a complete system of care around those in mental health crisis. Starting with calling 988 or 911, we really want to make them interoperable. So if you don't know about 988 and you call with mental health crisis, you can be transferred immediately to the 988 system to get the care you need, so that it doesn't matter who you call. If you need mental health care, we're going to give it to you in California, and vice versa. If you were to accidentally call 988 and need an ambulance because you were in the midst of a heart attack, we want to make sure you can get to 911. So that's a critical piece of the work we're trying to do. But then once you're on the phone with those trained experts, right, all of our suicide prevention hotline call centers are trained to handle people in crisis, that then we want to make sure that you get access to a full continuum of care, because it doesn't end in that moment of crisis, right? The de-escalation that is so critical for those who are suffering in a moment of crisis is the first step, right? We want to make sure that we have the stabilization services, that we can hand you off warmly to someone who can care for you and get those in mental health crisis into a better and stable place. And so this is really, so making sure we have the mobile crisis response teams to arrive instead of law enforcement, making sure we have stabilization services to support people through those first 48 hours, and then ensuring the work won't be done even with this effort, because we have to build a complete continuum of care underneath that to ensure that people are getting the mental health care support they need. But one of the things that is so critical about this work is that 25% of officer involved shootings are people in mental health crisis. So we are trying to change the dynamic of law enforcement shooting people of color unnecessarily. This is a really significant thing to do. A quarter of those shootings would stop if we had mental health care response to these incidents rather than law enforcement. And so we really want to make sure we're doing that. I would also note that the largest mental health provider in the nation is the Los Angeles County Jails. I'm going to pause there because that is a shocking fact, that the largest mental health provider, and I don't even know if you can call it that because they're actually a jail. They're meant to incarcerate criminals, and yet they're treating those who are suffering from mental health crisis because that's all we have right now. So we need to take this completely out of the public safety system and say, that's not how we're going to treat you when you're suffering from a healthcare crisis. And mental health care is healthcare. And we're going to put you into the healthcare system and give you those who are trained to support you and get you healthy and back to the stable place we know you can be to thrive and succeed in California. So where we are with the legislation has not passed. We will continue. We're at the beginning of a 2-year legislative cycle. So we will continue to work on the bill when we return to the legislature in January and move the legislation. Really hopeful that we can do that quickly. It's already in the Senate, so that gives us a little bit of a head start because I'm in the Assembly. So it's passed the first House, and we just need to get it through the second House. And so we're going to work to move that legislation, which will set up this robust system of response that we're funding. We will be funding this, which is really big for our counties. Currently, they don't have the resources to do this kind of response, and we want to provide that. We know that's a critical piece of this puzzle. But we did get a big win in the budget, which was $20 million to build up our call centers, to start the process of making sure that in July, when these phones start ringing, Californians get the response they deserve. We want to make sure the data shows that we should expect about a 30% uptick in call volume once the rollout of 988 happens. And we want to make sure we're prepared to be available to answer those calls. And we'll continue to work on building up the infrastructure, the interoperability with 911, and the important pieces that we really need to get rolling before July of 22. And then we've got to continue to push forward on making sure we have those mobile crisis response teams, those stabilization services, and a complete continuum of care. Because, I opened by saying that this all was born out of a conversation with Miles Hall's mother. Miles Hall was killed while in mental health crisis by law enforcement. His mother had worked tirelessly to get him the support he needed and was not able to because, to be frank, the government failed them in providing those services to get him stable and healthy. And that tragedy can't be unwrung. We can't bring Miles back, but in his memory, we can make sure that others don't suffer in the way that Miles' families currently suffer or lose their lives in the way that Miles did, because, those who are in mental health crisis deserve so much more than we are giving them today. And, I know today we're really focused on what it means to bring racial equity lens to this work. And there's no question that those who have privilege, those who are not people of color, have much more access to mental health care. And so it's communities that don't have that quick inroad that we're really going to provide access to. And again, making sure that those officer involved shootings, which again tend to be predominantly people of color, are ended by ensuring that the response is from someone not carrying a weapon, because that's not what's needed in these situations of healthcare response. And so, it's been such an honor to carry this legislation, to be at the forefront of this, but it has all been in partnership with incredible organizations on the ground who listen to communities of color, who are, making sure that we are doing the work that is needed on the ground. We've worked with consumers of these services, with the providers of these services, with people who've been impacted by our lack of services, to make sure that we're doing the work in a way that when we arrive at the solution, it is one that is accessible for every community, including our communities of color across the spectrum. And so I want to thank CPEN for their work in doing that. And I invite all of you to be partners in this work. It continues. We're going to have to move this bill forward in the new year. And each of you can have a role in advocating to make sure we move this forward. Getting something funded in the legislature is never easy. And we are dogged in saying that we are going to get the funding. We are going to get the funding not just for the phone system, but also for those mobile crisis response teams and the stabilization services. That's what the federal government enabled us to do, and we're going to do it. And your voice is really critical in that. So thank you all for being a partner in this work.
Thank you so much, Assemblymember, for all your work, for really creating these alternatives from law enforcement in terms of really responding to mental health crises. I know you mentioned Miles Hall, and also really uplifting the voices of the families of Stephen Taylor in San Leandro to Angelo Quinto in Antioch. So thank you so much for your work and for really advancing racial justice in this very real way with families and with communities who are deeply affected. So thank you so much. If folks in the chat can give the Assemblymember a lot of love, please do. Thank you so much again.
Thank you so much, Cass.
Thank you. Next up, I'm so excited to also introduce our community speaker, our keynote, Gladys Flores. Gladys Flores was born in Fresno, California. She comes from indigenous parents, Mixteco of San Agustin, at Tenango, Oaxaca. Her family and herself grew up working in the fields of the Central Valley, and although her parents migrated to the United States, they never forgot their heritage, as well as their native language, culture, and traditions, and they raised 7 children, including Gladys. So let's give a very warm welcome to Gladys Flores.
Thank you, Catherine. I'm very happy and excited here to be today, here with you guys today. I want to give a special thanks to CPEN for inviting me into being here today. Like Catherine was mentioning, I was born in Fresno, California, but that doesn't mean that my roots were very good. Inculcated to me into with my parents. We never forgot our roots. We never forgot where we come from. And I have a presentation for you guys, so you guys could kind of see. Sometimes explaining, it's not the same unless if we could be able to show some pictures. So I would like to see if Catherine could put my PowerPoint. Thank you, Catherine. The name of the power of healing, it's because the reason I named it is like this is because with us in the indigenous communities, we have knowledge into healing different ways with natural medicines and whatever Mother Earth gives us. So that's why that's the title of my presentation. Next slide, please. A little bit about my roots. I speak Mixteco. I come from the town named San Agustin Tenango, Silacayopan, Oaxaca, Mexico. This is where my parents are from, and they're very proud. I'm very proud to say that I'm a Mixteca, and that's the way how I present myself. Next slide, please. This is my family. I'm presenting you guys my four boys, my husband. We had this pictures taken this year. My two kids graduated. One of them kindergarten, and the other one from 8th grade. Family to us as Indigenous, that's it means everything to us. We treasure and value a lot what it is family. Next slide. Let me feel your pulse. Tell me what your heart is saying. And this is my abuelita, my grandma from my dad's side. They would base it a lot. Sometimes, if we had like a happy face, or sometimes we were upset or we were sad, grandma would go and talk to us, but she wouldn't never tell us like, talk to me, what is wrong. She would come and talk to us in a way like, okay, give me your wrist, and she would normally grab our wrist, and she'll feel like our pulse, and she'd be like, your pulse is telling me, you're upset, or your beating of your pulse is too fast. Are you angry? Grandma had always like different ways of how to communicate to us into getting us, out what was going on in within us. Next slide. That's why I put this part, mis abuelitos, my grandparents. How are you? It was another way to open a communication into sharing their feelings and thoughts. Sometimes, it we have stress, worries, work. We have so much thing going on into, so much thing going on into our day to day, and sometimes we don't stop, and our brains are just keep on going. And this was a way that I learned that my grandparents would talk to us. This is the way how my grandparents would talk to my dad. And it was, and I thought it was always so nice that sometimes there's other ways of communicating, and not really into you know talking into you need help, you need assistance, you need this. So that's why I this is where it goes, and everything centers to your heart, what your heart feels. Next slide, please. Services, like I was mentioning, why don't we search for help? Sometimes us as indigenous, it's very hard, very frustrating sometimes with the service, because the first thing that comes out, and they say like, okay, do you need mental health? And the first thing that pops out of our mind is that, no, I'm not crazy, I don't need. And sometimes we we do an auto evaluation of ourselves, and then sometimes family members comes over, and they start talking. They're like, oh, this is my problems, and then we compare, and we're like, oh wow, I thought I had problems, this other person has more problems. They're not referring them to mental health. But it's just sometimes for us just a way to deny that we need some assistance. But sometimes the way how you would ask for assistance, or the way how we could present assistance, sometimes it's not really the way how community sees that it's a trusted agency or trusted way to go and ask for help. Because within us as indigenous community, in the moment that you start speaking up, and whether if you're a man or a woman, sometimes it seems that you don't have control of your life, or you don't have a control of your family. So sometimes it is a lot of pressure, because the least thing that you want is to other people to know about what's really going on in your family. So that's one of the reasons why sometimes it's hard for indigenous community to search for this help. Next slide, please. Like I was mentioning, language, it's this is some, and this is the barriers too, because sometimes when we get there to the service, there's no interpretation available. Sometimes the culture, not everyone is comfortable in speaking their feelings, and sometimes probably the counselor or the therapist could say like, you know what, they're not really opening, or kind of like lose hope, and to just letting them go. Sometimes it's not really that, because it's just with us, sometimes we don't open up, because this is a hard part for us to open up into people, knowing what's going within our families, within our gathering our kids, with us. That is very precious sometimes for us, because that's where it could come, the judging part, into saying that as a mother you're not doing a good job, or as a father you're not doing a good job. So that is a crucial part. And the other one is the sensitivity. Sometimes we have to be sensitive into understanding the cultural background, and this is something that a lot of agencies or other people don't sometimes doesn't understand the way how the indigenous communities work. Sometimes it's easy for them to shut them down and say, you know what, you're good to go. This is what is this, and sometimes it's not because they really don't want to open. It's a very sensitive topic in with us. Just the word of you talking about mental health, that is a word that with us, with indigenous, you sometimes a lot of people just close up, and they're like, you know what, that is my business, and you shouldn't be talking. That's why us as organizations that we're on the ground, we do talk about mental health, but we have to figure different ways into how to connect with the community in order for them to open up and for us to provide that assistance. Next slide, please. I wanted to share with you guys a traditional healing, like I mentioned like I mentioned earlier. This is a process that we have, and I believe it's all America that has it in one or a different way. But I've seen it with other cultures that they have this. Next slide, please. With in my Mixteco, we call it ni'i. It's a temazcal. It's a sweat lodge. And I put some pictures on there. Is different ways how we do this. And the purpose of the temazcal, the ni'i, it's for us to heal. And you would wonder, what is the healing process? The healing process would be for mental, spiritual, and physical. Next slide, please. The benefits, or like I mentioned, the mental, the physical, and the spiritual. The mental part, it's where when we go inside there, it's just sometimes it could be a one-on-one, sometimes it could be a group. But if you guys see the pictures, there's some red hot rocks, and that's the way how they heat up a lot the rocks, and they then you go inside and they just throw water so it could create steam inside the room. But when it's only you have that opportunity to connect with Mother Earth. You connect with all the elements. You have fire, you have water, you have wind, and then they use the herbal essence, just for you to kind of concentrate, meditate in your own process. The physical health, it's sometimes when you have a bruise. A lot of these things we use it with women that just after the 40 days, we have that belief, after 40 days of you giving birth, then that's when you start walking in doing kind of your day-to-day thing. But before the 40 days, as indigenous, you're supposed to be, even if it's 110 and you're inside with, you want to be with your AC, they're treating you like if it's like 10 degrees outside. So you have a beanie, you have, very covered up, because if the belief is that, you get coldness into your body. So after the 40 days, you're able to do the ni'i to heal you as a woman, and try to fix everything together, put into your system back together how it was before. The spiritual part, that is where you connect, but you connect more through what I'm sorry. You connect through how to do this with you and on your own, and for you to purify your soul, for you. So sometimes if when you start sweating, your pores starts opening up. So sometimes a lot of people believe after they finish ni'i, at the temazcal experience, they feel like they have been reborn. This is the moment where you kind of, it's a cleansing of your body. So this is the benefits. The next slide, please. So this is I'm with Unidad Popular Benito Juarez. I hope you guys enjoy my presentation. That's my information. If you guys would like to contact me, I'm more than happy to contact you guys and do a follow-up or something like this. I hope you guys enjoy my presentation. I hope you guys I hope you guys learned something, and if probably you guys already kind of knew about something like this, I hope I kind of reinforce this back again. Thank you so much. Thank you for your time, and Catherine, thank you.
Thank you so much, Gladys. Thank you for sharing your story, for talking about how healing also means being in right relationship with our environment, with our loved ones. And once again, if you would like to contact Gladys, please do. As we move on for the rest of our program, we're going to be moving on to our workshop sessions. And so there's going to be 2 workshops. Both workshops will be recorded. And so on the green stage, there is workshop 1, which is called Healing Within, Finding a Culturally Competent Healer. The second stage is the blue stage for workshop 2, which is Overcoming Access Challenges to Mental Health Services. Those resources are in the chat. And so to navigate to a new stage, go to the left-hand side of your screen, click Stages, and select either the green or the blue stage. And so once again, in the chat, there are the names of the workshops. You can also find it in the program, and we will see you in the workshops. Thank you so much, everyone.